So my full name is Paul Jude Duwelious. I'm a medical doctor, orthopedic surgeon at Orthopedic and Fracture Specialist, and I operate at St. Vincent's Hospital. So I was always getting sick in 4th grade, and I had a blockage of my ureter, which is the tube that goes from your kidney down into your bladder, and that was poisoning my kidney. And I had surgery when I was in 4th grade, and from that day on I wasn't sick. I could participate in sports. I could be a normal kid again. And I really said I wanted to be like that surgeon. So it was an early on experience, and I have to say since 4th grade that's what I wanted to do. Now at St. Vincent's I do more joint replacement surgery where somebody may be limping, you see them in clinic, you get to know them, you've tried anti-inflammatories, injections, and physical therapy, and they say, look doc, I can't walk anymore. And you put a total hip in them and they come back at 6 weeks and they're so happy. And I think that's the most gratifying thing. You know, I think the biggest thing is there's so many fields of medicine that are interesting that I think it's hard to pick one. And it's more important now that you make an early decision because some of the specialties are so competitive, and since I switched specialties, that I think maybe put me behind a little bit, but it's not an impossible thing. I think, you know, I think you'll make that decision in medical school, and I think it's important to do rotations, and if you're interested in, say, the field of orthopedics, maybe pursue some research possibilities. Providence has allowed me to, it's a very efficient place. We're the highest volume total joint hospital in their whole healthcare system, which goes from Alaska to Texas. We're also the biggest contributor to the American Joint Replacement Registry, and also the most productive orthopedic hospital for orthopedic research, and have published numerous articles and have advanced orthopedic research in a big way. So I'm indebted to having a great hospital to work at. It's a Catholic hospital. I'm a Catholic guy, so that means a little bit to me too. I think anybody that's interested in a career in medicine, don't have anybody tell you that you're not smart enough. I really think that if you're a hard worker, and you've got to have a passion for this job, because if you're going into it for the money or for financial reasons, you're not going to be happy. If you're going in it to take care of patients, to do research, and to have a very rewarding, recession-proof job, because you're always going to be needed, I would urge you to just study hard and put your eggs in one basket. Like if you want to be an orthopedic surgeon, strive to get to know other orthopedic surgeons, do research at a university or at a place like we have, where we do have orthopedic research opportunities, and just work your way into it, because you can do it. And we need people like you that have a passion and that want to do it.